All right. So basically, Foresight Institute is a nonprofit focused on the development of beneficial technologies for long-term flourishing of life. And we usually did like once a month salons that were kind of like that were in San Francisco mostly. But we've already had a lot of people actually kind of suggesting to do Foresight X salons, and we've never really gotten around to it. And now there's this really unprecedented moment suddenly happening, which is creating, I think, this kind of like vacuum to do something and to coordinate efforts. There's no day that passes where I don't see anything, any effort that I think people should be launching their heart and soul at right now online. And I was wondering whether we could maybe serve as a kind of like coordinator of those efforts, or give them a little bit more visibility globally, connect our efforts, and there's definitely there will be most of the salon topics that we're going to have will be I think quite, at least like put into place by an intention to kind of like create something positive out of this, and to show some action. So like the quote that I really love is, "Only a crisis, actual or perceived, produces real change. When the crisis occurs, the actions that are taken depend on the ideas that are lying around." That's by Milton Friedman. And so my hope for today is that we can pick up those ideas. And you know, COVID-19 is really unprecedented. And so we are trying to do like maybe 3 things with the salon. One is we're trying to connect more, right? On a very kind of like broad level. I think being isolated, and Brad, you made a really good point. You know, being isolated can be really isolating for a lot of people. And I think just seeing faces every once in a while, and seeing new faces, seeing faces from all over the world has been really quite life-changing for me already this morning. So that's number 1, but I think we can aim higher. The second thing is, I think, creating some kind of community resilience, and creating some kind of like civil resilience in the face of this crisis, and like really trying to experiment and doing something new here. And then I think the third one is like, you know, the more high-hanging one, and the one that, you know, is potentially a little bit further down the line, which is kind of like, how can we use this crisis as an impetus for kind of like larger change, to kind of set civilization up on a track where we are much more likely to flourish in a really, really, really long positive future. So without further ado, we started this morning with a salon with Jan Tallinn on kind of existential risk communities, existential risk opportunities from this crisis. And yeah, it has been quite, I think, Brad, you have to unmute, or are you muted? Okay, good. All right. Yeah, I think, and because I think it's recording you. But nevertheless, I think you know, what has been quite like, you know, quite interesting this morning is that a lot of people kind of like joined from all over the world, and we had a really interesting conversation that I think we wouldn't have otherwise had, and a lot of kind of efforts were already aligning. So I think a few ways in which you know, that just to kind of like start this and prefaces with it. So if you now go into the chat window, I will send you I will send you a collaboration spreadsheet that you may or may not have seen already. And if you haven't, then I encourage you to join this. This is basically the schedule for the following weeks. You're welcome to add the schedule to your Google Calendar. There's a link for that there. But also, you please, if you're zooming in from all over the world, share the salon with others whose efforts you think could be benefiting from a larger exposure, and or who just have kind of like really crucial efforts for a flourishing long-term future to share. Also, if you are seeking specific help, there's a collaboration tab now in the spreadsheet that you can edit. So please add yourselves to it, and please add your friends to it, or encourage your friends to add their efforts to it, so that we can kind of try to coordinate efforts a little bit and coordinate support, so that if people were interested in donating, or if people were interested in volunteering, they would have a place in place where they could look. This is my kind of like attempt at coordinating efforts. I'm not sure if there's already other attempts out there. If so, please let me know. Then I would love to coordinate with them as well. Okay, great. So this is now the second edition. We're having a lot of participants again on the Zoom call, really much more so than we could have in a physical space. I created a poll. Perhaps you are interested in taking that poll. I think if you just click on poll, down there in the screen, there's just 3 very simple questions. For who is it the first Foresight Salon? Where are you located physically? And how is everyone feeling? So if you want to take maybe like 30 seconds to fill out the poll, that would be great. And Brad, maybe we can take the time to mute and unmute ourselves. Do you want to unmute yourself?
Yeah, no, I've unmuted myself. There's a display, if you look at participants, tells you who's muted and who isn't. I think you as organizer actually have the power to mute people if you want to mute them. Creon, you're unmuted. There's a few other people, Mama, someone named L, who is unmuted. Everyone else is muted.
All right. Yeah, if those people would maybe want to mute themselves. Great. Okay.
Hey, Brad, I'm where's the poll? Sorry, I didn't catch it.
Sorry, the poll. Hey guys, hi. The poll is down here in the screen. There's a polling button. Oh, it's so lovely to see you. You have no idea. Oh my God. Down here, there's a polling button. Down here, there's a polling button.
Sorry,
in
down
your
here,
Zoom
what do you mean?
in your Zoom window, there should be a polling button.
I don't see that.
We don't see it.
No, actually, okay. Oh my God, guys, this is totally on me. I haven't launched the poll.
Okay,
I'm definitely still learning. The poll should be there now. All right, now if you want to take some time, that would be amazing. Just about 30 seconds or so, then I want to leave it up to our speakers. All right, so wow, currently more non-Foresight Salon and or non-Foresight event attendees than yes, then 90% are from the US, and wow, people are feeling all over the place, but no one is feeling very negative.
There's no button for New Zealand.
There's no button for
New Zealand.
No button for New Zealand. Well, it's via continent. But hey, Anna, it's very nice to see you. I hope you're hanging out in your van and having some fun over there. So
no, we're in group quarantine. We started a post.
You started group quarantine? Okay. Wow. Okay. Well, I see a few of your housemates behind you as well. Okay, great. So without further ado, let's launch into today's salon. And if you have ways in which I can improve this, and Anna, if you want to mute yourself, that'd be great. Oh, you are muted, but you still are you? Is Anna showing for every one of you as the main person? Brad, is Anna showing for you as the main speaker?
Well, I don't think you put it into a speaker mode. Right now, it's just in a group mode, which means people can choose between seeing the person who's talking or seing the group. That's in the upper right-hand corner of your screen.
Great. Okay.
If I click into speaker view, I see Brad.
Yeah, you see whoever has the microphone on. But there is a way that Allison, if she's master of the system, can say this person is the speaker and has the powers of matching this.
I see. Okay.
All right. Let me master it bit by bit. But I think here I am again. All right, so without further ado, now I want to introduce the second salon of today, which I think we have 3 really fantastic people. And I'm so glad that all of you were able to join. And what we're going to do is each of those 3 people, Alex Gladstein, Matt Bell, and Jonathan Cain, will do a 5 to 7 minute intro on kind of their current efforts and their current response to COVID-19. Then we're going to do a breakout, and you can actually follow them into different breakout groups. I will break you out. And then afterwards, we're going to come here back later, and we may break out again for some optional kind of like connecting cross continents. Okay. All right. So thank you for joining, the three of you. Thanks for being so flexible and available. Without really much further ado, I want to give it up for Alex Gladstein from the Human Rights Foundation, who has given a fantastic talk on authoritarianism and COVID-19. And perhaps you'd like to kick us off with this very, very cheery topic. All right, Alex, you take over.
Thanks very much. Really a delight to be here, and really nice to see all your faces in these grim times. I have 7 minutes, so I'm going to try and fit a lot in. We're going to go through the Chinese Communist Party cover-up, which involved the World Health Organization. We're going to go through why their data is totally unreliable right now. We're going to go through a discussion about competency and incompetency with regard to governments. We're going to talk about why a police state is not necessary to fight the virus. So those are the main things I want to work through with you in a quick fashion. So I think a lot of us are going to be asked to make trade-offs regardless of where we live, ranging from like very open democracies like Norway all the way down to North Korea. Governments are going to say, hey, these are extraordinary times and we need to take extraordinary measures. And my whole kind of thesis here is that we can't let them go too far. At the end of the day, the virus is absolutely devastating. It's going to kill and maim so many people, especially in places with like bad infrastructure, medical infrastructure like Syria, Venezuela, India, etc. But at the end of the day, we'll defeat it. What we won't defeat, though, is governments becoming more authoritarian and taking our rights away. And in 20 years, that's what we're going to be looking at, not the virus. So we'll start with like why you wouldn't want an authoritarian system in the first place for a public health disaster reaction scenario. Many of you, of course, will remember like what happened after 9/11 in America with the things like the Patriot Act and the like quick and then, over time, slow, gradual, vacuuming up of different civil liberties. These things, of course, also happened in closed societies. China promised a lot of temporary emergency measures for the Olympics in 2008. And of course, they never went back, right? They started taking those measures and applying them like in mass in places like Xinjiang, et cetera. Basically, if we give up our liberties, we end up in a state, the hopeful situation would be you'd end up in a state kind of like China, which a lot of people would say, hey, this is like a relatively competent dictatorship. Of course, you're probably more likely to end up somewhere like North Korea or Venezuela or Iran, which we'll get to. But let's look at like why China handled this extremely poorly and why I don't think they deserve any praise for handling this. This virus was identified by doctors at Wuhan Central Hospital in late December. And they realized that this was like a novel coronavirus. This was not anything they'd seen before, and they tried to warn authorities before people left Wuhan to go back to their homes after the holiday, right, on the 1st of January. So they tried to do that in vain. They were censored, they were reprimanded, they were even persecuted, and some of the citizen journalist type folks who tried to report on this were disappeared. At the same time, Taiwanese authorities figured this out, and again, before January 1st, tried to warn the World Health Organization about this, and they were ignored. And if you didn't know, the World Health Organization excludes Taiwan. They consider Taiwan a province of China. If you look at the data that they list on their website, they describe Taiwan as Taipei and its environs as a province of China. So the World Health Organization is a political organization that basically listens to whatever Beijing says. So I'm not sure if they were excited about participating in this cover-up, but they certainly did. So you had Taiwanese scientists warn the World Health Organization that there was human-to-human transmission as early as late December, and they were ignored. In the time between December 31 and January 23rd, which is when Wuhan was finally shut down, 7 million people left Wuhan and the pandemic was totally sparked. Now, of course, other countries have been very incompetent, but you need to know that like this whole pandemic was sparked by a cover-up that involves the World Health Organization. And I've gone into detail in that in many Twitter threads, and I can share lots of articles ranging from the Financial Times to Chinese publications about that. The second thing relates to like why people are trusting CCP data now is crazy to me. I mean, we just saw them cover up the entire the pandemic itself. We've seen them lie about prison camps in Xinjiang, and yet every mainstream media outlet is reporting the data as if, yeah, on February 15th, they totally like flattened the curve. And this does not resonate with like on the ground reports, which you can read. And it's just really mystifying to me. And it's kind of dangerous because it suggests that with these draconian measures, we can be like China and stop it. But actually, they're not stopping it. And we just will never know the real numbers. All that being said, I wanted to, of course, mention the fact that democracies and open societies can be very incompetent as well. And that's something else we have to look at. I mean, the United States government, in my perspective, has been unforgivably incompetent. But this is sort of a different problem than authoritarianism. At least as a US citizen, I knew what I saw was happening in Wuhan back in January, and I could start to prepare myself for that. I mean, Chinese citizens are locked in a censorship and propaganda bubble. I mean, they're being hand-fed stuff like, hey, this is like an American bioweapon, crazy stuff like that. I've talked to a lot of friends of mine who have family there and tried to gather some data on this, and it's pretty astounding. And this is all kind of like adding up to a global narrative of we should be like China and we should have a police state to deal with this virus, to deal with global pandemics like this. And I just think that's false. I mean, it's really crazy. Even democracies like Israel, the United States, et cetera, are kind of already ramping up the surveillance beyond what they had before. In China, it's so intense that you are now color coded according to your risk profile, yellow, green, or blue, or yellow, green, or red, and it sort of dictates where you can go and what you can do in China. So I think that a lot of people have.
May I cut in for 1 sec?
I'm almost done. I got 15 seconds left. So basically, the conclusion is that people are going to say, maybe you've got to make a trade-off. Maybe we need to be more authoritarian. And I think that's just a false trade-off. I think we can ramp up testing. I think we can isolate. I think we can do things that don't endanger the fabric of our society. We don't need to have a police state to fight the virus. And I think that police states, especially beyond China, have been really bad at dealing with this, and that we don't want to go down that road. So that's my my opening statement.
Okay, I'd like to say one thing.
I love it. Okay, Creon.
Yeah, I'll be short. 2 things in response to that. First is a small thing. Regarding the color code, I don't think the color code per se is the big problem. The big problem, as I see it, is that there's no transparency about what the color code actually means, from what I've heard. No one knows what causes their color to change. No one's explaining what causes the color to change. It's not clear that the color code actually does much good. It seems to me, as I've mentioned perhaps previously, that before long, we may have, in other parts of the world, a similar sort of scanning color code kind of thing. But basically what it'll say is, if you've already had the virus and tested positive and now you're recovered and tested negative, green light to go do most things, okay? That would be a useful thing to know. That could get a lot of people back into the workforce fast and stuff like that. So I think there's ways to do this that are transparent and good, and ways to do this that are a lot less good and a lot more confusing and unfair. Now, I also think that you can generalize that to practically anything about the US and China, not just COVID, not just color codes, not just, it's like, if you take the best of China and the best of the US, or the best of the West systems, if you take the best of each and combine them, you get a fantastic world. If you take the worst of each and combine them, if you take authoritarianism plus incompetency, as you pointed out, which is the worst of each system, and combine it, you get hell on earth. So really, it can't be that one is good and one is bad. It's that we have to.
I was saving this for the breakout, but I might as well show. I'm trying to make a graph of like competency versus openness, and look, I want to be up there with Taiwan and Korea. I don't really want to be in an incompetent democracy, and I certainly don't want to be Iran, which is an incompetent dictatorship, and I don't really want to be a competent closed society either, for the reasons I outlined. So I'd like to model our goals to do what societies like Taiwan and South Korea are doing and have done to an extent.
Question.
All right, thank you so much. I think before we take another question, in the interest of time, I think whoever wants to talk about this should join Alex's breakout, which we're going to do in a second. I think in the interest of time, Alyssa, is that okay?
Okay.
Was it you? Yeah.
Yeah.
Okay, great. In the interest of time, perhaps we can have Jonathan Cain next. Okay, and Jonathan, thank you so much for joining. You're going to talk about kind of like a very kind of like community resilience focused effort, which is the Community Safety Net Fund. And the stage is yours. Can you hear Jonathan?
No, Jonathan, you're muted.
Yeah, can't hear.
Okay.
He is not muted. He must have a sound problem on his.
Yeah.
Okay, Alyssa, shoot out your question. Alyssa, shoot out your question to Alex.
What's the evidence that you've seen that the CCP is lying about flattening the curve? I mean, you know, obviously we don't know if their numbers are exactly right, but there have been a lot of reports about how, you know, they're shutting down the hospitals and their cities are getting back to work and so on. So what have you seen that contradicts that?
Yeah, so there's like interviews with doctors in hospitals in Wuhan and in these regions that are basically saying, and I have them linked into a thread that I'll share with you, but they're basically saying that like, they don't even know what's going on. They're being told, like the latest story that came out today was that basically they're not counting like asymptomatic cases as cases at all. So those cases aren't even being counted. And there's just no transparency at all. And people are really concerned and frightened. And basically the Communist Party takes the data and gives it to the WHO, and nobody checks. There's no checking. And again, this is a regime that literally lied about like the entire outbreak. So I think the burden is on them to prove that the data is real and that we should ask for like verification of this data. And it's really disappointing to see the world media like report that data as like fact as opposed to speculation.
How about if Matt goes next, if Jonathan isn't ready?
Jonathan, are you ready?
No, he's not. No sound yet. So how about we go to Matt?
Yeah.
Yeah, I can do
that. Thank you so much. Oh, Jonathan, is that you? No, I think Jonathan's still figuring it out. Alex, thank you so much. Wow, that's a great breakout to join. Next one up, we have I had scheduled you as reasons for COVID-19 optimism, but you also just published an incredible Medium post. So take the stage and share what you got.
Yeah, gladly. So it's been an interesting couple of months. I was one of the first people in my social network to start sounding the alarm on COVID-19, where I remember the day of the Wuhan lockdown going like, oh, hold on, like even though most people in the West haven't heard of Wuhan, it's like close to the size of New York City. And for an action as bold as like shutting down an entire city, like something big must be going on here. And I started digging in and started, like, as we got into early February, noticing cases of community spread in other countries. And once it was popping up in like South Korea and Iran and Italy all at the same time, I really got worried. I thought, okay, there's no way this thing's getting contained. It's going to go all over the world. And it's going to be really intense. And governments here don't seem to be taking it seriously at all. It's not in the news cycle yet. The markets haven't reacted. So I had this like feeling of dread. But I've noticed that over the last few days, I've actually been feeling surprisingly optimistic. And I wanted to talk about some reasons why. By the way, I'm noticing that everyone else's video is frozen. So if you can hear me, just wave at me so I have a sense. Yes, okay, cool.
We can hear you.
Fantastic. All right, I'll keep going. I think Zoom might just do something clever around like not updating if there hasn't been enough movement. Anyway, so why am I optimistic? So I agree with most of what Alex says in terms of China's government just absolutely trampling on human rights. But other measures that they took in terms of shutting down businesses and travel restrictions and whatnot, I think those worked. I actually believe that if China hasn't beaten COVID-19, we would see evidence of that pretty quickly, because this virus grows exponentially, and you really can't hide, 100,000 plus people being infected. But even like aside from like questions about China's numbers, we can look at other countries that are a lot more open. So for example, Taiwan and South Korea and Japan are examples of countries that have done a substantially better job than we have of controlling the outbreak. They have all shut down businesses to varying degrees. And in fact, like a decent number of businesses have remained open in those countries. But what they have done is wear masks, do aggressive testing, with the exception of Japan, and very aggressive contact tracing with the exception of Japan. And South Korea at this point is like largely has the epidemic under control at this point. You can look at the graph and see the numbers go up, flatten, and go down. And at this point, I think they're just getting like a few tens of cases a day. And they just did that by ramping up their test capacity to many tens of thousands a day, and using mostly good old-fashioned manual contact tracing to test asymptomatic individuals and like anyone who might have had contact with someone who's sick. And they're doing it. They're making COVID-19 go away, and they're doing it without shutting their whole country down. So that's something where, hey, it's modern democracy. They're making it work, and that could be our future if we wanted. Another reason I'm optimistic is that the US government is finally taking this seriously. As of a couple of weeks ago, the idea of like shutting down a major city, closing businesses, all of that just seemed unthinkable. And now there are major cities like, say, the Bay Area and LA and Seattle that are showing the way. And I have hope that this can happen nationwide soon. Another thing I'm noticing is that it seems like critical equipment, like masks and other PPE, is starting to become more available. So China, for example, ramped up their production of masks from 10 million a day to an astonishing 200 million a day over the last 3 months. And that was a lot of factories getting converted and running overtime and whatnot. And so I believe that a lot of the shortages that we're really afraid about right now could rapidly turn into a situation where we not only have enough masks for healthcare workers, but we have enough for everyone else. And that could happen in a matter of a small number of weeks. And China's no longer hoarding masks. That happened in January, that even like US-owned companies couldn't get their masks out of China to the US. That's no longer the case, and masks are starting to flow. Let's see, what else am I optimistic about? The US's testing capacity is going up rapidly. So the situation in early February was there were only about 400 tests total. The CDC was forcing everyone to use those tests, and they were messed up. Like, it was pretty much a worst of all possible worlds. And the CDC ended up changing their mind along with the FDA to allow third parties to start spinning up COVID tests. And at this point, the US has performed well over 100,000 tests. And so our daily testing capacity has gone up astonishingly. And that basically means that, you know, if there's political will to do so, we can start following more of the South Korea style testing and contact tracing strategy that seems to have been quite successful. I think the last thing that has me optimistic is that we're starting to see progress at identifying treatments. I think it's going to be a long time until we have a vaccine, probably 12 to 18 months, according to most estimates. But there's a tremendous number of existing drugs out there, and right now there are a number of trials on a range of them, including extremely commonly available drugs like hydroxychloroquine, and that's showing some effectiveness in human trials that has at least been repeated once outside China. There's a French researcher that published a few days ago. And even though the sample sizes are small on this research, it points toward multiple promising treatments. And I think with scientists around the world testing a very large number of drugs, both in vitro and in vivo, I think it's reasonably likely we're going to find at least one that can be applied toward treating most people's infections. And this is a huge deal for healthcare system capacity, because if you can treat, say, 80% of COVID patients with the drug, and they end up not needing to go to the hospital, that takes the number of COVID cases versus healthcare system capacity and like radically changes the equation. Like, the reason so many people are dying in Italy is because their healthcare system got overwhelmed. And if we can buy ourselves a little bit of time with these city shutdowns and social distancing measures and mask wearing, that will let us like really know for sure which treatments work and start applying them before our healthcare system hits capacity. So yeah, that's my big picture view of how we get out of this. And so thinking across all of it, I'm seeing a path that will take us out of this exponential growth curve we're seeing right now. And I think countries like South Korea have already shown us the way.
All right, thank you so much. I think, Jonathan, you need to leave at 45, is that correct?
Yes.
Okay, I'm wondering how we're going to do that on breakouts then. I think, Matt, if you're okay and we save a question for your breakout to give Jonathan the option to go now and maybe have like a few minutes on this breakout. Is that okay with you?
Yeah.
Okay, great. All right, cool. Okay, Jonathan, then thank you so much, Matt. And then Jonathan, if it seems like the audio is working, if you'd like to go next and tell us a little bit more about the Community Safety Net Fund and how people can help.
Yeah, thank you, Allison. Yeah, hi everyone, I'm Jonathan Cain, helping out with the Safety Net Fund. It's a nonprofit initiative that some friends and I started a little less than 2 weeks ago out here in the Bay Area to support artists through this period of severe economic disruption. You know, a lot of people are still fortunate to have day jobs or savings, but, and it's cliche, artists are often people who get by with piecework or gig work, or by working events and gatherings, all of which are now canceled. so to help give back to people who have given all of us so much through their creative expression and view of the world, we started a fund to give no strings attached grants to low-income artists. We wanted to spin this up as quickly as possible and make it as easy as and frictionless to give out grants as possible. So we just have 4 requirements. 1, you have to live in the Bay Area, just to limit the scope. 2, you have to provide some kind of proof of art that you've created in the last 6 months. 3, you can't be eligible for unemployment. And 4, you must have had less than $1,000 worth of income in the previous 30 days. And so we're giving out $500 to each person who applies on a first come first served basis and is eligible on a first come first served basis. And so far we've received over 800 applications and have raised just around $200,000. Our goal is really expanding the more funds that we raise, because right now we can only support about half the people who've applied. And the need and the demand will always be much more than there'll be funding, which is not a news story for this kind of initiative. But the part of the impetus came because when we looked at the kind of response that we were seeing from governments around the world, and certainly here in the U.S. To COVID-19, there, a lot of people are working really hard, but there's also a lot of incompetence and bureaucracy and turf battles getting in the way. And I don't think it'll surprise anyone if any of the economic relief that's being talked about in Congress right now doesn't trickle down to a lot of the people who live more on the margins and need it the most. So what we're looking for now as we continue to work on this is, if you have any interest in supporting this, we would very much appreciate that. If you know people who may be interested in funding this as well, that would also be greatly appreciated. If you're interested in setting up something similar in your own community, or know people who are working on this, we would love to share what we've learned, what we've been thinking about, the challenges that we've been dealing with. And because we want this to be the kind of thing that, maybe Milton Friedman or Andrew Yang's idea of universal basic income will happen at some point. But I think that one thing that a lot of people are feeling inspired by right now is the idea that we don't have to wait on governments to do things for us. We can just do them ourselves, and do them on a voluntary, non-violent, non-coercive basis. So you can learn more at the website safetynetfund.io. That's safetynetfund.io. The website just went up last night, so we are literally still editing it right now. So don't take anything on there other than like the application form and the donation form as the gospel truth. But as I said, the edits are all being finalized right now. So I'll be on the breakout group for just a little bit, and if you want to get in touch with me for anything about this, you can contact me directly, jonathan.cain@gmail.com. I'm in on the Google spreadsheet that Allison circulated, or contact us through safetynetfund.io.